And so the majority of our faith community did not want to be put into a place where parishioners were asking them to find ways to have congregate settings. Some did. The governor's initial order was a bit confusing on that. Every mayor in Texas, every county judge, large city mayor, every large city county judge reached out, as did I, and had good discussions, and the governor's clarified his order. I want to read a sentence from that and explain to you how we'll move forward. In his advisory, he says, Texas is a big state, and the transmission rate of COVID-19 varies in different communities. Given this, houses of worship should work with counties and municipalities to evaluate the rate of local community spread and determine the appropriate level of mitigation strategies to implement. For example, more detailed guidance from the CDC currently recommends that if a community is experiencing substantial community spread of COVID-19, then the houses of worship in that community should cancel all in-person gatherings of any size. Accordingly, and I've talked to some of the ministers from the smaller church groups today, that my friend Pastor Godsey, who is with the Hispanic Evangelical Ministers Coalition, and others, to explain that in Dallas, we will continue on with all services being either online, telephonically, drive-through. So we have some drive-through services where you can drive by and drop an offering, and somebody can kind of toss you a communion packet. Or you can sit in the parking lot with one car, one space between you, and listen like a drive-in movie in places. So they're finding ingenious ways to feed the flock and take care of people. And I so appreciate what they're doing and the partnership that we have here with our faith community. They are truly heroes in this fight, and I can't thank them enough for what they're doing. Someone who is not a hero and who I want to call out specifically, and I'll be calling out others like this, is the corporation Hobby Lobby. Hobby Lobby has kept some of their locations open, and I just personally found out about this yesterday. I like to deal with everyone with grace. I appreciate grace that's extended to me, and so many of you have extended grace to me, that I like to extend grace to them. And so after a call where some press people revealed to me that Hobby Lobby and another employer that quickly shut as soon as they got a call from me were open, I asked my executive staff to prepare a cease and desist letter and to reach out to someone at that company. In order to get a copy of a good cease and desist letter, you got to keep in mind, I'm communicating, my staff communicates with every other jurisdiction who's a couple of weeks ahead of us. We're constantly talking to New York and Ohio and Philadelphia and San Francisco and Seattle. Within minutes of them asking, does anyone have a good cease and desist letter, people began sending, we have a problem with Hobby Lobby, people began sending us cease and desist letters on Hobby Lobby from other places. And so I realized this is a bigger problem than just Dallas. And then today, someone sent me a CBS News story that Hobby Lobby is taking the position that somehow the rules don't apply to them. And so I just want to make it clear to Hobby Lobby and anybody who is foolish enough to follow in their footsteps that in Dallas County, the government and 99.9% of the business community puts public health over profits. And in Dallas County, our law enforcement agencies will ensure that you abide by the control orders. And so I would just encourage everyone, if you're still at Hobby Lobby and you work at Hobby Lobby, particularly in management, that you go ahead and lock up and leave as soon as possible. I want to point out, if I could, our website, if we have that, there you go. This is in Spanish. Then there's one in English. You can just go back to the Spanish if you want to. Go to any one you want to. But this is the best way to get a hold of us for now. The emails that you're sending to business COVID-19 are so stacked up, it will literally be weeks before people can get to them. But there's a whole team of volunteer lawyers and others that are working on the Google Docs on this website. So I just encourage everyone to use the website. By the way, use the website to tell me about that smoke shop in your neighborhood that thinks they're an essential business. Use that website for your concerns that your employer is not following our guidelines, or to, any other concerns that you may have, or any suggestions that you may have. I don't want you to think that I'm down on business, because I'm very up on business. I couldn't be prouder of our businesses. And it's a slap in the face to the businesses that are following this order that a few outliers are putting the community in danger. Finally, I would suggest to our public there are plenty of places to buy yarn and art supplies that are fully in compliance with our order and have robust online platforms. And there are places also that are open, these big box stores, to get those things. Remember that the way we determine what is an essential business is not, me and a couple of guys who stayed at a Holiday Inn Express last night, okay? It is the federal government has a critical infrastructure and Security Act list, a CISA list, a cybersecurity infrastructure list. And so we work off that list. And if your business isn't on that list, then it's not covered in our order. Same thing with Governor Abbott's order. He's working off the same list we are. I want to say a couple of things on the plus side before turning it over to Phil. I think this state is much safer today than we have been for the last 2 weeks, now that the whole state is doing the safer at home model that we've been under since March 22nd. And there was I think in the New York Times today, there was a map that showed how our area, our 3-county area, was gray for less activity, and then the surrounding area was red for people still bouncing around. So the hope is that everything will be gray, which is the better color in that map, before long. And then we see the benefit of that 2 weeks later, because the 100 cases that tested positive today, those cases got exposed 2 weeks ago, okay? So you won't immediately see the benefit of the whole state being at safer at home, and you won't necessarily see it in a sheer number fashion. In other words, the numbers won't immediately go down. What we're trying to do, and I'll just use my hands as an illustration, we know we're at the front of the curve. Now, is the curve like this, or all the actions the community and your leaders are taking making the curve more like this? The key is to get that curve flat enough so that the bed capacity and the ventilator capacity that we're feverishly working to increase is not overrun by the shape of that curve. I think we're making good progress on that. I think the bed capacity in our hospitals today is very good. How good it will be in 2 weeks, it depends on the efforts we're making today, both your efforts at personal responsibility and, frankly, the efforts my team is working on to make sure we get more capacity and ventilators. I'll close by saying this, and then I'll turn it over to Phil. We can do this, okay? We are going to make it through this. We are going to have some tough times together, but we're going to stick together. Now we've got the whole state working together, and we will get through this. And it's so important that you do your part by exercising the best personal responsibility that you possibly can. And so let me just give you some examples. When you're going to the grocery store, don't take 5 people, take 1. When you go to the grocery store, don't take the last item off the shelf, leave some for your neighbor. No need to hoard. Move from selfishness, we're all selfish, I'm selfish, okay? We move from selfishness to sacrifice. We make the best personal decisions based on those CDC guidelines, which you can find on this website, and they get updated all the time. So for your family, take a look at that regularly. Make those good personal decisions, and we'll get through this together, and we'll come out the other side, and we'll get our economy turned back on, and we'll get this nightmare over with. Phil, you want to?
So just, real brief recap on some of the numbers. Again, we had 100 new cases reported today, bringing us to a total of 831. And as the judge mentioned, 2 deaths. Also in the jail, as of today, the latest report, we've got 23 total cases associated with the Dallas County Jail. That includes 21 inmates and 2 detention officers. Of the 23 cases, 2 were newly reported, and 1 was an inmate and another was a detention officer. We have the latest graphic now updated with today's information showing the hotspots in terms of which zip codes. And we have another, we didn't get, okay. So we'll have another sort of graphic later that shows more of the growth by zip code, which zip codes have had more new cases in the last couple days or last week. So that, again, those are helping us also target some of our ground activities. That we have some community outreach people who are in the community on the ground trying to put educational materials, put posters up, signage, work with store owners and shop owners to implement the physical distancing, put tape on the floors in some of these shop areas, those sort of things. So those are how we're using some of the numbers now, and we're continuing to monitor how this grows. And as the judge mentioned, now it's about 2 weeks out from when some of the orders were going in place. So that's sort of some of these numbers today reflect some of the actions from back then. Thank you.
Any questions?
Judge, as it relates to Hobby Lobby, I know some governors and other mayors have forced closure with the help of police in other parts of the country. Is that something that you thought about, considered?
We're doing it.
Sorry?
Yeah. He's asking, are we using law enforcement to close offenders like Hobby Lobby? Yes, we are. Today, tonight, as we speak. Any other questions before? I know you've got your own programming to do.
So Reserve at Richardson, I think yesterday was at 2, if I'm correct, and now it's at 5. Is that, first of all, is that, an area you're particularly concerned at being a major cluster? And are there any additional regulations that you even really can consider at this point to further security at senior care facilities?
If we can think of ways to protect our seniors, then we will swiftly implement that. This is one of the worst parts of the job is, worrying about and trying to help the people in those senior centers. We don't want to see happen here what's happening on both coasts and the senior centers. I want to make clear again, since the questions come up, because there's still people that are tweeting at me asking me this. If your loved one is in a home that has never had a COVID positive case, you don't need a test to get your loved one out of the home. If your loved one is in a home that has had a COVID positive case, at least for now, we have the capacity to do a same-day turnaround test for them if you are going to take them home. We cannot test every person in a nursing home who is going to stay there with those few tests that we have, okay? But if you want to take your loved one home, if you're ready to take your loved one home, tell the nursing home, they'll tell us, we'll get that test done.
And Judge, this is a question for either you or Dr. Huang. We're hearing that it's taking some time for people to get those test results back from county testing sites versus the other testing sites, how long reasonably should people be expected to wait for the test results? And what are you doing and what perhaps is causing that backup? I know you've addressed that before, but if you could talk to people about that again.
Well, okay, so the backup on the testing deals with how long it takes the lab to perform the test. We have a precious few tests that are created, the lab, we're at the Dallas County Health and Human Services Lab. This is dozens a day, not thousands, that it can be done this fast. And so what I'm saying is we'll use some of those tests on your loved one if they're in a COVID positive nursing home and you want to move them home. You have plans, concrete plans to move them home. For other people, the testing is taking, in some private labs, more than 7 days. The testing currently at Ellis Davis and AAC is taking how long, Phil?
Week to 10 days.
Is it up to a week to 10 days? Week to 10 days. And that deals with the federal government's lab system here, not
Judge,
any local.
neighbors complain about a group of people playing basketball at a court. Will you guys be removing the hoops as Houston did, or?
So I'm leaving it up to each city to stop that from happening in whatever way. You know, in a perfect world, I'm sorry, he was asking me about people playing, you know, shirts and skins basketball as opposed to just, you know, a shoot around or something. And of course, when you do that, when you're playing even a one-on-one game, you're always within 6 feet of each other, unless in defending your opponent you've done something very wrong. but anyway, so you know we can't have that right now, right? And so I'm leaving it up to the cities to try to find some way to make that not happen. You know, it's my role to shut the parks down if they can't do that. Different cities are dealing with it a different way. Some are taking down hoops. Some are using kind of park rangers. But we're going to look to see, you know, what works and encourage the cities to do what is working. And then the last thing I want to do is shut down what little recreational activities our people have if they can do them safely.
Hey, Judge, some people are asking, or they think they can still cut hair at home. Can they still do that? And if they cannot, how are you going to enforce that?
That's a good question. How do you enforce somebody sneaking their barber into their house? I'll tell you, my hair's about to get shaggy. You're going to get to see what happens when it gets long. But yes, that is not allowed under our order because that's we're trying to keep a minimum of bringing people into the home. You know, I'll tell you what, we'll take a look at that for people. Because that is just one person, but at least currently it's not allowed.
So not even one person? 'Cause some of these people, they live off of that. So
I understand.
So not
And
even
I understand that we don't have the police to go sit in front of your house to see if your barber sneaks in. But anyway, currently it's not allowed.
In light of the headlines that we've seen today saying that the CDC is looking at new studies that suggest that wearing a mask could indeed help after all, even if you're not showing signs or symptoms. What do you say to Dallas County about that? Are there new recommendations in light of what they're looking at this point?
You know, our problem right now, we will look at that, and we are working very, very hard to get a huge supply of masks and PPE. But right now, just to be honest, I don't have enough masks and PPE to put on doctors and nurses 10 days from now, maybe 7 days from now. In some of the hospitals, you know, we didn't have enough 2 days ago. I don't think we do today, but so we've got to improve that.
Those who may have like surgical masks of their own, are you not ready to suggest going out in public and wearing a mask?
I don't think, Phil, do you have a thought on that, or we need to make a recommendation?
Yeah, I mean, I think some of the recommendation, or what's being looked at is certainly the non-medical masks and even some of the, I mean, so that not taking away from the supply from the medical and hospital setting, but other barriers that could be used both from protecting from the, you know, droplet spread and also the, you know, said keeps people from touching their eyes, nose, and mouth and things. It's definitely being looked at. We're waiting also from some more. It sounds like CDC is considering revised guidance on that also. So we're actually following that very much.
And how do you all track the, once people have tested and they test negative, how do you, I guess, kind of track what they're doing and how long they, how long they quarantine? How do you track the negative results versus the positive results? Or do you just kind of?
No, it depends on, in terms of what setting. More it's that we give them the recommendation if they were exposed, for instance, to someone who was known positive and had a close exposure. If the test was negative, then they would still need to be quarantined for 14 days. That was part of the concern sometimes about testing, to not give a false sense of security. And so, they need to still adhere to the proper recommendations based on their exposure sort of history and situation.
Clay, apparently the president during his news conference, and I missed this, but he said something about asking for hospitals in Dallas and Louisiana to be staffed by the federal government. Do you know if he was referring to Kay Bailey, and is there anything new in terms of staffing?
We saw his press conference as well. The feds are staffing Kay Bailey. We need help on other things too. I've asked Governor Abbott to consider a waiver for out-of-state respiratory therapists, as he has with out-of-state nurses, so they can give them some brief refresher course if they need it, but we have a lot of those here, and this is a very respiratory intensive disease. So we're looking at things such as that, as much as they could do, and if they do it, I hope they'll do it in the places where we have the biggest spread, which to my knowledge is here. There may be something getting close to that down in Houston, I'm not sure, but so I hope they will do that. That will certainly be helpful. It's not just, and we do have enough doctors and nurses for your loved one to go to the hospital today, but as doctors and nurses also get sick or also get quarantined, then you lose that line of defense if it's not replenished. Now remember, we've got this Dallas County Medical Society list of retired doctors and nurses that is somewhere in the hundreds now, and so that will help some. But it is similar to a war. We are having to throw waves of soldiers at the disease, and so we need all the help we can get. And if I didn't repeat the question, he was asking about the president's comment about using military doctors to help supplement us, which we certainly welcome and need. Any other questions before we wrap up? If not, thank you all for what you're doing as a community. Keep doing it. I'm so proud of y'all, and we will get through this. Good night and God bless.